Hello, I'm Michael Pierce, and this is The Human Condition. Today we're talking about what signs of your body will tell you that you might be unhealthy. So these are signs that are not necessarily horrible signs, but signs that are subtle. Signs that are subtle that might tell you or your doctor that you're not quite as healthy as you thought you were. And the really good news about them, first of all, is that they're not terribly life-threatening, but they also tell you that there's work that you can still do. So if you think you're healthy and you've got these, there might be more work you can do to get even healthier and to prevent further disease. The first, probably most interesting one and most common one that I see that people forget about is fungal toenails. If a person has fungal toenails, where their toenails are thickened and yellow and raised and separating from the cuticle below, this is a sign that the person not only has fungal material in their body, but that they have poor circulation to their toes. Because generally, with good circulation, you don't get fungal nails. So you won't see it in the fingernails, you'll see it in the toenails. So you have to really take off your shoes and take a look. And a lot of people have their toenails done, and so they're covered with polish, and they're covered with different types of epoxy or other things that you can't see. As a doctor, I often tell people, please have those nails removed so that I can see your actual nail beds of your fingers and toes. So try to plan that when you see your holistic doctor that you've got all those nails clear and you can see them clearly. There's a lot we can do about this. We can explore and examine all the various factors of why a person might have poor circulation, why they might have difficulty with a fungal infection of their toes. And there's topical treatments as well as oral treatments to help combat that problem. We don't want to just put a drug on the surface of the toe and try to get rid of it, because the fungus lives within us. It's not just at the toenail. The next one that we talk about is bleeding gums. It's very common for people to have bleeding gums that just bleed when they brush their teeth, or they bleed at random times during the day when they chew on something or eat something, or that they have bleeding gums when they floss routinely. If this is happening, there may be a problem that needs to be pursued, and it could be many things. It could be a problem of vitamin C, it could be a problem of too much carbohydrates, it could be a problem of improper cleaning, it could be a protein deficiency, it could be a difficulty of metals in the mouth, poisonous metals in the mouth from dental materials. It could also be a difficulty of gingivitis or periodontitis, where there's the tissue around the teeth have infections, not just the enamel of the teeth. So not just cavities, but infections of the gums. This is worth going to a dentist for, and it's worth flossing yourself, and it's worth doing not just flossing, but water pick, where a water pick is sprayed water into the tooth area. And this can be done very carefully. There's all kinds of videos on how to do this on YouTube. But bleeding gums are a sign that something's wrong, and if you continue to have recurrent bleeding gums, you're either flossing too hard or there's something wrong that needs to be paid attention to. The next one is bad breath. There are several kinds of bad breath that can happen, and we've all experienced this. We know what happens, and part of it could be bad breath caused by something in the mouth. It could be bad breath caused by something in the gut, which is fermenting, or that is a fecal problem. And a third one is that it could be a carbohydrate problem that isn't just fermentation. So let's talk about them in the mouth first. If there's a difficulty in the mouth where there's food that's stuck and that's rotting, often flossing and water picking and brushing teeth will get rid of it, and then everything's fine. Sometimes a person needs to see the dentist, sometimes they've got decay, sometimes they need a dental x-ray or an examination or a measure of those pockets in their teeth to find what the pocket depth is. That's done by a dentist or a hygienist. And so that's pretty easy to figure out and understand. If it's chronic, a person can usually address this by using water picks, and they can use dental rinses that are usually herbal rinses that help a person wash out and clean their gums. And it works very well. People do heal quite a bit. The next one is the gut component of bad breath, and that would be when there's a difficulty of a person who's really just getting kind of functionally constipated. What they've got is a whole lot of undigested food that isn't traveling rapidly enough through the system, and they'll start to get what is basically fecal breath. It may sound gross, but if you've got fecal matter in your large intestine and it's moving through, it's very possible that the gases emitted by that fecal matter make it to your bloodstream and diffuse out of your lungs and come out of your breath. And so if you've ever noticed that your breath changes after a bowel movement or after you've done some kind of a cleanse, maybe you've done colonics or you've done colon irrigation or you've done home enemas, or maybe you took some kind of a drug to maybe have a colonoscopy, and then all of a sudden you got cleaned out and you had quite a bowel movement. Other people will eat some foreign food that they're not used to, and they will just have a huge diarrhea, and they'll notice that their breath is better afterwards. That may be a sign that you've got stasis or sluggishness in your digestive tract, and you're really just getting the smells of your large intestine coming out through your lungs. The last one is almost a carbohydrate problem, and it's not just fermentation. When a person has excessive carbs compared to fat and protein, there is often a production of hydrogen gas and methane gas. And this is a little bit hard to tell from the previous GI problem that I talked about, which is kind of sluggish stool. But this one is a little more stale. This is kind of what you'll see sometimes, the old person's breath, or mothball breath, or breath that has to do with a person that's just basically consumed too many carbs. You may notice it yourself if you have too much cake, or if you have too much bread, or if you have too much pasta, or too many crackers. You may notice that your breath is very stale. It's not particularly stinky, it's just very stale. And that's what happens with carbon dioxide and methane and hydrogen when they combine. This also shows up in SIBO, or small intestinal bacterial overgrowth, where a person eats too many carbs and they get an overgrowth of bacteria or fungi in their intestine, and they bloat. They fill with air, they fill with water, and the measurement of their waste gets enlarged within about 3 hours after eating. And so that's that kind of carbohydrate. And the cure is really simple. You just cut carbs. It works really well. Some people take a lot of probiotics, and you can do that, but if you just cut the carbs, it really normalizes fairly quick for most people. It can be an addictive problem, though, because cutting carbs can be much more difficult for some people than others because of that carb addiction. The next one is just plain old indigestion or gas, bloating, pain. If somebody's got indigestion or gas, bloating, pain, that's not normal. You need to see a holistic doctor. You need to talk to yourself and figure out, what am I doing wrong? Because healthy people don't have indigestion. They don't have headaches. They don't have declining vision. They don't have declining hearing. They age out beautifully. And so when you see all these people that are getting older, we ascribe it to age because we're basically lazy. What we're observing is sick people getting old. This is not aging. Aging is people that are getting older, and there are signs of aging that can happen and other signs that are not necessarily aging. They're just getting sick. So it's important to realize that not all skin aging is aging. Not all digestive complaints, not all gait problems, not all movement problems, not all pains and digestive problems can be just written off as, oh, that's aging. Usually it's an avoidable type of problem that someone can look at and help you figure out. Constipation and diarrhea are often in combination, and I have to tell you, the literature is pretty clear that most alternating constipation and diarrhea is a problem with bile production and bile balance in the pancreas and liver and the gallbladder, if you have one. And that starts way up there in the digestive tract, not down in the colon, even though most colon diseases come from the bile, which is, 21 feet higher up the digestive tract near the stomach. And so consider understanding bile with your doctor as a problem. I mentioned earlier, declining vision and hearing is a sign that there might be something wrong with you that you can fix. It might be reversible. I'm not saying you don't need an eye doctor or an audiologist, but I'm saying that sometimes these problems are reversible and they're temporary and they're not a fundamental change in the eyeball or in the ear, and that it's more of a body chemistry problem or a brain chemistry problem that can be reversed with food and diet sometimes. Smell or taste changes, especially when they're metallic. Now, this can be a gallbladder problem. It can a gallbladder and bile problem. It could be a heavy metal poisoning, or it could be a simple change in electrolytes and minerals. It could also be the exposure to organophosphates or other pesticides or herbicides or solvents. So whenever your smell or your taste changes, you want to notice that. And it may be that others around you notice that. They notice that you're not smelling things or you're not tasting things. You may not notice it, so you may have to enlist the help of your friends, and you may have to try different foods or smell different things to see if you've lost some of that. The probably greatest cause of this is a zinc deficiency. Our lifestyle leads to zinc deficiency very, very often, and many of the food lectins we eat that are in otherwise healthy beans and nuts and seeds and grains have phytic acid or other lectins that bind to zinc and carry them out of our body. So we may eat high zinc foods, and then we eat high lectin foods, and we end up pooping our zinc out and losing it and just renting it. We don't really get to keep it. So a lot of times a real simple thing is to try a zinc supplement and see if it brings the smell or the taste back. There are a few nail signs that happen in your fingernails and toenails. These are, the most common one is the longitudinal ridges. If you've got longitudinal ridges in your fingernails, this usually has the feel of a washboard effect. So you take your fingernail and run it across those longitudinal ridges that run this way. And when you feel that washboard effect, you know it's real. If it's only visual but it feels smooth, it's not really longitudinal ridging. If you can feel it, it's longitudinal ridging, and if you can hear it, you're sure that it's there, because it'll feel like you'll actually feel and see and hear that ridging. And that usually is a combination of a lack of stomach acid, a lack of minerals like calcium and magnesium, and it causes a poor formation of the nails, and they start to ridge. Nails are supposed to be smooth. They're not supposed to be ridged like that. And so longitudinal ridging is a sign of a complex problem of deficiency of stomach acid and minerals that lead to poor nail formation. There are also pits in the nails that can form. Pits are a little more serious. If you see pits in your nails that look like, someone just stabbed your nails with a sharp object and you've got these little pits in the nails, that's often an autoimmune sign, a sign of some kind of autoimmune disease. And there are many of them out there, but the general concept is if you have pitted nails, you really need to see a doctor and try to figure out what that is. The good news is most autoimmune diseases can be controlled through diet and through lifestyle work and lots of other factors that we'll get into in other videos. So it's not hopeless if you do have an autoimmune problem. The white spots on the nails, or white nails generally, are two different things. White spots on the nails tend to be a zinc deficiency or some imbalance of zinc and copper. And we see that fairly often. They're just splotches and white spots that are on more than one of the nails and on both hands. Another one that happens is where the nails are almost uniformly white. And that is, instead of pink, that is called Terry's nails. And that is a problem that is generally by most textbooks attributed to protein metabolism problem or a thyroid metabolism problem, where the person may be deficient in protein or inefficient at digesting protein, or they've got a thyroid inhibition from food lectins, or some other type of problem that holistic doctors see all the time, and it is usually reversible in most people. There is also a condition called transverse troughs. Transverse troughs, or Bowes lines, or Fever's lines, often show up in the fingernails of people that have been under stress. This happens to people that have had a fever or that have had a sudden stress like maybe an injury or a hospitalization or a surgery. I've even seen it in breakups and divorces and audits. I've seen it in financial stress, where a person just gets a stressful event and they grow out a line or a trough that goes across their nail. As the nail grows forward from the cuticle in this direction, there becomes this big wave, this big trough, and you can see it on all the nails, and it grows out as the nail grows, and it moves through and eventually gets clipped off as you trim your fingernails. But it takes a while to grow through the nail. So it'll emerge as this trough, this low spot, and it's fairly wide, and it will come out and it will grow through the nail. It's not anything to be too alarmed about unless it keeps happening over and over again. If you see someone who keeps producing these fever lines or Bowes lines over and over in their nails as a rank that comes forward from all the nails over and over again, then there's something that's stressing them out. It could be emotional or traumatic or even abuse. These are subtle signs that a person or a child might have a real health problem. Another test that shows up, or another sign rather that shows up, is allergic shiners. We see it more often in children, but sometimes we see it in adults. And this is where a person begins to get dark spots under their eyes in this group of veins called Batson's venous plexus, which is an area that in older people tends to get puffy as they fill with fluid. But in young people, it tends to turn dark when there's an allergy. You see it during seasonal allergies like hay fever, and you see it during food allergies like allergies to gluten or dairy. I see it a lot of times in my mucus-filled children patients that come in where they're just filled with mucus, they're full of allergies, they've got all kinds of allergy to food, they've got almost always gluten and dairy, but it can be other foods too, and they get this allergic shiner where it looks like they've got black eyes. It doesn't always have to be that black, but it can be subtly dark, and a lot of times you'll see it go away after they clean up their diet, and the family never noticed it before, and then after it goes away, they feel like it's better. You'll also see people that do this allergic salute, and the allergic salute is this. You'll see children that will wipe their nose, especially, and some adults will do it. It's not just this, but often the children will really wipe that nose and they'll do the allergic salute. And so that's wiping because they've got drip. They've got this sinus drip all the time because of all the allergy and sensitivity. It could be airborne allergy, but again, my premise is that most airborne allergy comes from food. If you've got a food problem, you're going to have a burden of antigen from the environment, and that's going to make you even more sensitive to airborne allergies. Not everybody has this that has airborne allergies, but I have found that most people with airborne allergies can be successfully treated by doing a whole bunch of holistic stuff that includes getting their food right and getting them off of food allergens and antigens and toxins and additives. The last one is eczema or atopy or atopic dermatitis, which all the textbooks will tell you that most skin dermatitis is not antibody mediated, which means there's no antibody that's going to show up on a blood test. And most of those are caused by either food or some kind of topical exposure, some kind of toxin, some kind of laundry detergent or some kind of soap, or some kind of chemical in a perfume or an underarm deodorant or a lotion. Sometimes it'll be chemicals on clothing. There's all kinds of chemicals that are put on clothing today to block odor and fungus, and those are toxic to some people. So it's a matter of food and topical, and most of the time cleaning up and getting back to natural fibers, getting back to natural soaps, and not putting anything on your skin that you wouldn't eat generally is the idea. So that is all the signs for this module on signs that you might be unhealthy and that you could do better work.